Hey, I'm Annabelle, nurse, birth doula, and mama, and I'm here to build your confidence in birth. Today I'm talking to you about how to effectively push during labor and in birth, that second stage of labor. And I'm specifically talking to mamas that have med-free births, no epidurals. So if that's you, stick around. We're gonna talk about how you can listen to your body and push effectively and get ready to deliver your baby. So the most recent research shows that mamas that do not have epidurals should be guided by their own pushing urges and their own desires to push when they get to that second stage of labor, that pushing stage. And this is not historically what has really been taught or been promoted in the hospitals with your clinical care team. Historically, mamas are directed when to push and when not to push. And this has created a lot of confusion, a lot of doubt, and even a lot of anxiety for first-time moms and even second, third-time moms. When should I push? Oh no, what if I'm not gonna feel the urge? What if I don't push effectively? What if I don't know how to birth my baby? And I'm here to tell you, based on our studies that we have, clinical research, your body will tell you and you will have that urge. When you have no epidural, no pain-reducing medications, and you're listening to your body, you will know. And historically, we see directed pushing, whereas I wanna talk to you more about self-directed pushing. So directed pushing is what nurses have taught for years in the hospital setting. And there's a lot of nurses still teaching it, even if they're young and new nurses. And this directed pushing is also known as purple pushing or the Valsalva maneuver, and it is not seen as effective for moms anymore. This is when moms are taught to take a deep breath as the contraction is building, and then tuck her chin and push as hard as she can for 10 seconds without blowing out. This increases a lot of intra-abdominal pressure, and it was thought to help moms push more effectively. The problem with this pushing, with holding your breath and pushing for 10 seconds, is that it decreases oxygen for mom and baby during this pushing time. And a lot of moms end up breaking capillaries in their face and are very tense, and then after birth they're sore and they have trauma to their face and to their body because of this very intense pushing. So they're told to push for 10 seconds and then take a deep breath in, push again for 10 seconds, take a deep breath in, push another 10 seconds, and then relax and wait for the next contraction. So that's 3 big pushes. That's 30 seconds of holding her breath during one contraction. And during that contraction, baby's already receiving less oxygen because the muscle itself is contracting so hard. And so this is not effective for moms anymore. We see this through research and even just really looking at a mom in a very practical way. If you have no clinical experience, saying that doesn't look healthy. She's not allowed to grunt or groan while she's pushing. Think about when you go to the gym and you lift weights and you tried to hold your breath. It would not be healthy or effective for you in the long run. You want to make sure that you're breathing out and really just listening to your body when you lift weights or push your baby. So this leads me to more of the self-directed pushing. This pushing where everyone's quiet. Mom gets to decide as the contraction's building if she's gonna push during that contraction, because you don't have to push with every contraction. You can take a break because this is a marathon. Pushing can take a couple of hours for a first-time mom, and so you really have to pace yourself. Mom's allowed to decide when she's gonna push. She gets to decide in what position she wants to push, maybe not on her back, because it's not effective for every mom to push on her back. And she also increases her risk for tearing her perineum, that skin that you really don't want to tear when you give birth. So mom's allowed to push in which position she wants to push in. She's allowed to blow out all that air as she's pushing. So she takes a deep breath in and blow it out. While she's pushing, she can push it out slowly, she can grunt, she can groan, she can push for 8 seconds, she can push for 10 seconds, however mom wants. This is self-directed, and this is seen as very effective for moms that don't have epidurals. But it's very important that as you prepare, as you're with your birth coach, whoever it is, I love to coach moms to get ready for birth, and so I would gladly help you. I've got a link to my website below if you want to get on a free consultation call with me. So it's very important for moms to really prepare and know what they're getting into, to listen to their bodies and be able to tell the nurses in the room, this is how I'm pushing. This is how I'm pushing. I'm listening to me, my body, so I can sit here and talk to you one-on-one here and tell you that you're gonna know. Let's get you trained and ready to really get in tune with your body. How do you ignore everything that's going on around you when people are talking to you and tune into your body? And then you get to the hospital or your birthing center and you have your clinical care team around you, your OBGYN and your nurses that first of all don't have a lot of experience helping moms give birth that don't have epidurals. When we are seeing 75 to 80% of moms in the United States asking for epidurals, this changes the pushing experience. So your nurses aren't used to the moms that want to push and feel everything that's going on in their body. Your OBGYN is maybe on the phone with the nurse asking, well, what is the cervical dilation? And the nurse is saying, well, it's 10 centimeters, it's complete. But mom doesn't have that urge to push. And the nurse comes in and says, okay, let's start pushing, but you don't have the urge, but you want to listen to the nurse because she's the experienced one. And so there's a lot of confusion and discourse once you actually get into that birthing center, that hospital, and you have learned from me saying, okay, you're going to have that urge, but your nurse and your doctor are saying it's time to push. And who do you listen to? I have had 2 stories recently, 2 births that I've been a part of and educating these moms to get ready for birth. And both of them have very different experiences than what I'm talking about. For the first mom that I'm going to talk about, I educated her about you're going to have the urge to push. Okay, she was having a very natural birth, no epidural, and she gets to 10 centimeters. The nurse checks her cervix. Yep, you're 10 centimeters. And I'm asking my client, do you have this urge to push? And I didn't really even have to ask her because I'm watching her and I'm not seeing this change in demeanor. When you get to that second stage, you are going to have your contractions spread out a little bit more. You have this overwhelming urge of something's different. I feel a lot of pressure, and you all of a sudden get this second wind of energy. You're ready to be a part of the experience. And I didn't see that with my client. The nurses are starting to tear down the bed, starting to get her into a pushing position, and I'm really trying to communicate with my client about whether she has this urge to push, but the nurses are very adamant that it's time to push because she's complete, because she's 10 centimeters. And the research actually shows that the dilation of the cervix, so how open your cervix is, we talk about it being complete, open to 10 centimeters approximately, that is just one part of the puzzle. We also need to look at, well, where is the baby? How is the baby rotating? Rotation is a huge part of your baby coming down the birth canal. Also, the descent of the baby. How far down is the baby in the birth canal? As your baby descends and comes and presses down on your cervix and is ready to start entering into the vagina, you have nerves in that area that baby's head, your baby's head, is going to press on. And that is what creates that urge to push, is all of a sudden there is a head where there shouldn't be a head, and you feel like you need to push something out. A baby, your baby. And so my client wasn't having that experience, but all of the care team was convinced that it was time to push. And like I said, the nurses and the physician are very used to patients not saying no to the epidural. They're used to patients being in bed with an epidural and they don't feel anything. She is numb from the abdomen down. This is a little bit of a conflict of interest here. We're talking about nurses. I had 3 nurses in the room with me while I'm with this client, and they're all 3 coaching this client to push. And I'm here as her birth support, her doula, really trying to communicate with her about what do you feel. And she didn't have that urge. So that's definitely a conflict of interest when we look at literature and we look at what's actually happening in the hospitals, is that the cervix is open and everybody thinks, okay, it's time to push. But mama, if you don't have that urge, then you should not exert your energy on pushing. Is it harmful to push? The research doesn't show that it is not harmful for mom to start pushing even if baby has not given that sensation to push yet. But we're talking about birth experience here. We're talking about how exhausted you are, because pushing for first-time moms can take 2-3 hours. Sometimes it's shorter, but we're talking more about 2.5 hours. And so this is a very active phase of labor. You're using a lot of calories, a lot of energy. You might already be exhausted from the hours of labor that led up to that second stage of pushing. And so you really want to think about, I might need to conserve some energy. So even if my cervix is dilated, if I'm not having that urge, then I'm just going to maybe wait and allow my body, my uterus, which is that big muscle contracting, to push baby down a little bit further until I get that urge. Your body, your uterus is going to contract and push baby down, whether you are part of the experience pushing actively or not. Now I'm going to talk about the flip side of it. Mamas that feel an urge to push before the nurse has said, you're complete, you're dilated. Historically, this was seen as a no-no. If mama has an urge to push, but the nurse is not feeling that cervix completely open, there was this thought process of you will damage your cervix if you start to push. This is now been debunked in a sense, that really what midwives start to see is when mama says, I have an urge to push, if she were to check that cervix right away, for 20 to 40% of moms, that midwife would feel that the cervix is not complete yet. So maybe what's happening is that baby's descending and is pressing on those nerves, but the cervix isn't open yet. But that could be a good thing, that when baby is pressing on that cervix, that's what's going to cause the cervix to open more. So for mamas that have that urge to push, again, listen to your body. If the nurse says, don't push, your cervix isn't complete yet, if your body is telling you to push, you are safe to push. If you want to wait, you can. Your uterus will continue to contract and press baby down and open that cervix up. But again, we're talking about your birth experience, having all these nurses yell at you, all these different things. Push, don't push, wait, go. And it can be very defeating. In research, we're seeing that moms that are told not to push, they start to doubt themselves. And then when it's time to push and the nurse says, okay, it's time to push, okay, but how? Like I wasn't listening to my body before, or I was trying to, but you told me not to, so I don't know what to do. So again, from the get-go, it's so important to get that coaching, to be confident in what your body is saying. Listen to your body. So now I'm gonna talk about another client that I had, and she was instructed not to push because her physician was not present yet. So this is very emotional for me. It's a very difficult topic because physicians have a lot to do. They're in many places at one time. And so it can be very difficult for me to talk about. My client was ready to give birth. She said, something's different, I have this urge, I need to push. And so her nurse came in and was a little bit questioning her about whether she really was complete or not, really if the baby was ready to descend and be born yet. She checked my client's cervix and said, oh, there's a baby's head right there. But the physician wasn't at the hospital yet. She was actually quite a bit of distance away. And so what do we do here? Do we instruct the patient to listen to her body and to push? Well, that is not what hospital policy is. It is definitely recommended that nurses not deliver babies because there could be a lot of complications. This is why finding a birth center or a hospital where there's always a physician on call can be a big bonus, so that you don't have to worry about there not being a physician nearby. This client was told to lay down, labor down, so lay down in the bed. The nurse crossed her legs and told her not to push until the physician arrived. Now the baby was already in the birth canal, was already descending, was ready to come out. This was very painful for the client. It was a very difficult experience to hold her baby in. I have heard many stories of moms saying it could have been one of the most painful things that she'd ever done to try to hold her baby in. To hold the urge to push is like telling somebody not to blink. It is very difficult. It's a very natural and normal process to birth your baby. Her uterus is continuing to contract and try to push her baby out into this world. So this instance with my client was one way where nurses instruct patience not to push. But a lot of times what mamas will hear is as their baby's head starts to crown, so just that top part of the head starts to come out of the vagina, the nurse or healthcare provider will say, okay, stop pushing, hold your breath, pant, blow out a candle, just take those little breaths like that. And the thought is that if we can slow down the birth of the head, we can prevent tearing of the mom's perineal tissue. And this is true. We don't want to blow baby out like a cannonball. We want it to be a much slower process. But the issue with really instructing mom on this is that when we look at moms that have very minimal interventions, very little direction, very little directed pushing, we see that moms do this normally. That it is a very normal process that as your baby is crowning, you're gonna feel a burning sensation. It's going to be a lot of pressure. And so moms usually bring their legs together. And this allows the tissue to have a little bit of extra wiggle room, and it slows the process down. We also see moms very naturally change their breathing patterns. So the question here is, should moms really be told, don't push? They're probably gonna do it normally, but it might not be the timing that the nurse was directing. It might just be on her own timing. And so this is where really having everybody just be quiet, the whole healthcare team, so that you can focus and listen to what your body is saying is so important. So when you come to this video to hear me talk about how to effectively push in your labor, my number one tip is that you will know. You will know. And if you don't know, guess what? Your body is going to birth your baby. Your uterus is contracting, which means it's pushing baby down into your vagina. And if you were to put your hand down near your vagina and you feel your baby's head, you can push then, because once the head is crowning, it's definitely time to push, and you can give your body a few extra helpful pushes and push the head and then the body out. Now, through my experience with other mamas, and then even my own experience with my 2 births, you will have that urge to push before your baby is crowning. I guarantee you will feel something is pushing on these nerves, something is not where it's supposed to be. I feel like I need to poop really, really bad and I cannot hold it and I'm going to push. And so you will have that urge. But my second tip for you is to push in a position that is very comfortable for you. Now, it's not a comfortable experience to give birth without medication. It's just not. Now, when you get to the other side of it and you're holding your beautiful baby, you're gonna look back after a couple weeks and say, that was a beautiful experience. That was a birth I love to remember. I love to talk about my experience. But when you're in the moment, find a position that feels like you can push effectively. That's what I mean when I say a position that is comfortable for you. For me, it was hands and knees for my most recent birth experience. That was how I felt like I could be in control and I could really manage the pushing process. So get in a position that it feels effective to you. Your nurses and your physician are gonna wanna put you in bed, on your back, with your legs up. If that's what they do, but it doesn't feel right, don't feel like you have to stay in that position. It's not one position for pushing. You can change positions while you're pushing. So say, excuse me, can you put the bed back together and I'm going to change positions, and be forceful about it. Have your birth coach, your doula, whoever it is standing by your side supporting you, really help you. Push those nurses to help you get into a position that's comfortable for you. My third tip for pushing effectively in labor is to breathe. Don't hold your breath. You will thank me for this later when your face still looks all put together and you don't have broken blood vessels and you're not purple and just so tense from the pushing process. Breathe out. Again, you're gonna have some nurses coach you to hold your breath, to not blow that air out. This is old research. This is not the most current way to do it. So listen to your body, blow that air out, grunt and groan if you need to. Your body is pushing. You are helping the process. It's not just all up to you and your willpower. Your body will do this with you. So you can do this, mama. I am here for you. I am cheering you on. If you really want to get ready to give birth without an epidural and be so confident in what your body is able to do, I want to be your birth support in this. So down below is a link to my website where you can schedule a free consultation call with me where we can talk about your birth goals and dreams. And I would love to do this with you. I will see you in the next